the Aces Optimus Show with your host, Dr. Craig Morris.
Hello, everybody. I'm Dr. Craig Morris. Welcome to Aces Optimus, where we're dedicated to optimizing human potential in the clinic of life. We have multiple sponsors for Aces Optimus, one being Advanced Clinical Educational Seminars, which is acesforme.com, and our courses that we'll be speaking a little bit about. In addition, we're also co-sponsored by the Prague School of Rehabilitation at Charles University in Prague, Czech Republic, who organizes the DNS courses globally. Our third new co-sponsor is the Inside Edge with the great K, Kevin Weeks, former NHL goalie and now ESPN and NHL hockey analyst, with his new network that just launched earlier this week. You can find him and his new network at iehockey.com. With that said, today's guest is Dr. Glen Harris of MSK Plus, a course organizer and a sports rehab chiropractor who's a native of Ontario, Canada, and still lives and works in Canada. He is a clinician at the Canadian Memorial Chiropractic College, and in addition to being in private practice in Ontario, in the Ontario area. And so welcome to the show, Glen.
Well, thank you so much for the invitation to join you this afternoon for a chat.
So tell us a little bit more. I've given a little brief introduction, but that is only the very beginning. We have an excellent clinician with years of experience, both in as a sports clinician, as a chiropractor, and also as an educator and an organizer for courses in both Canada and in the United States. And I'm not quite sure if you've organized courses elsewhere. So tell us a little bit more about when it started, what it came about, and also just talk a little bit about your background as far as key mentors or issues that came up that were really stimulating and helped to direct you to where you've come.
Okay, well, awesome. Thank you for the opportunity to chat with you today, Craig. So my journey started at the University of Waterloo when I went to the kinesiology degree at the University of Waterloo. And during my studies there, one of my professors was Professor Stuart McGill. So we'll talk a bit more about Professor McGill as we navigate through my history. But I finished my undergraduate training at the University of Waterloo, and I knew I was going to be going off to professional school, but I didn't actually have the resources to go right into professional school. So I worked as a kinesiologist for a company called the Canadian Back Institute. And that was a company founded by Toronto spine surgeon, Dr. Hamilton Hall. So I worked as a kinesiologist managing back pain patients with exercise prescription for a year before starting my chiropractic training at Canadian Memorial Chiropractic College. I finished my Canadian Memorial Chiropractic College training in 1997, and then I completed a 2-year sports science residency program. At that point, I was the third cohort to go through that program and be successful at challenging the exam. Became a clinician at CMCC in 2000. So I've been a clinician ever since 2000 here down at the South Riverdale Clinic in kind of Lower East End, Toronto. In 2006, I started wondering about, who would I like to hear from a continuing education perspective. And I reached out to Professor McGill, Stu. He had just published his first book, Low Back Disorders book. And I was having my students read that book as one of their book reviews. And rather than be kind of didactic, reading, lecturing kind of professor, I thought, well, why don't we invite Professor McGill to come to Toronto and give us a 2-day workshop on building the ultimate back. So I reached out to Professor McGill and we coordinated a course here in Toronto. And that was kind of the origin of the company. I was really interested from a kind of a selfish standpoint. Who did I want to learn from? And I coordinated most of my CE opportunities about who did I want to learn from. And then I invited all of my friends and colleagues to come join me. Since that, I've come across numerous presenters, both in the chiropractic world as well as the physio world and the medicine world and the rehabilitative world and the strength and conditioning world. So through those seminars, I've got to work with Dr. Craig Liebenson, Dr. Irene Davis, Dr. Rich Willie, as well as numerous other professionals, mostly in North America. But at one point, Dr. McGill asked me to organize a course for him in the UK. So we organized a course in Manchester for a 2 full-day course. And then subsequently, we organized a course down in both Rio de Janeiro as well as Sao Paulo in Brazil. So it has been international. And from those opportunities, I've met tremendous amount of clinicians from around the world and continue to learn and reach out to them with regards to hosting additional courses around the world. That part of my career is kind of a private. I have my own education company called MSK Plus, and that's basically kind of the founding of that. My private practice is in Midtown Toronto. That's kind of changed its kind of demographics over the course of my career. My background was in sports sciences. So I did most of my early training was in the sports kind of science world. Then I became really interested in persistent pain. One of my previous students, Dr. Dimitri, probably one of North America's leading chiropractors in the evaluation and management of patients with persistent pain. He took a pretty prestigious position at one of the local Toronto hospitals. And I was competing for a position also at that hospital later on. And I joined that clinic that was called the SPARC Clinic, the Schroeder Pain Assessment Rehab Center, where I was assessing about 15 to 20 persistent pain patients a week, running them through historical features and key physical exam features, and basically phenotyping those patients into either nociplastic, neuropathic, or nociceptive pain. I subsequently have left that position, but I still had a keen interest in that persistent pain population. And more recently, I joined a center that we work with a lot of more pediatric athletes, both gymnastics, cheer, dance, and acro. And then finally, I have my teaching positions at the Canadian Memorial Chiropractic College. I've been a clinician here at the center that I'm working at now at South Riverdale for the last almost 20 years. And I maintain a private practice in Midtown Toronto. When you ask about mentorship, some of my key non-chiropractic mentors, Professor McGill would be the first one on my list. He was an old professor of mine, and I've hosted him with the company probably for 15 or 20 courses. And I think if it's a nociceptive driver, Professor McGill is probably one of the world's elite clinicians on assessing for the nociceptive driver, whether it's load, whether it's posture, whether it's position. And then in the chiropractic world, probably my earlier mentors would be Stephen and Jan. So Dr. and Jan inspired me to, as I was a student, to start to investigate what's happening with manipulation and immune function. So we did some early trials on manipulation and immune function, and subsequently we followed up on that fairly recently, and just recently published a trial on patients with persistent back pain and salivary factors for inflammation, and that'll be published very soon.
So how many papers have you published? Would you estimate?
I'm not a big academic scholar from a publication world. Probably about 10.
Yeah.
We do have a bunch of papers coming out from the Ontario Chiropractic Association, where we actually had the evidence-based council. And so we have about 7 papers coming out from that group. with regards to kind of implementing evidence-based practice into the chiropractic profession here in Ontario and in Canada. And then from a mentorship standpoint, when I was a student, I had the privilege of working with a Dr. Glen M, who has recently passed away, Dr. Ron King, and Dr. Robert Greenmouth, who was also my residency supervisor. And subsequently, since then, I've had numerous mentors. I had the privilege of working with Tom Hyde, US-based sports chiropractor, and through
Good friend and colleague.
Through Tom, I met Greg Dewar, I think, who you interviewed recently.
Right.
And I had the opportunity to work with Dr. Peter Gorman from New York. He's the founder of Microgate and some of his technology with regards to quantification of human motion, particularly gait. So I've been pretty blessed to be surrounded with a whole bunch of really high caliber kind of people in the research world, in the sports world. I was also involved pretty heavily in the political world of sports sciences, chiropractic in Canada. One of the mentors there was Dr. Brian Seaman. He's practicing in Halifax. Dr. Greg Uchez, who was our president for that college for 10 years. He practices in Calgary. And then one of the founders of the sports college was Dr. Tom Sawa. So he was the first, my first associate practice with Dr. Sawa out in Mississauga, Ontario. Dr. Sawa is still in practice after 35 or 40 years. So I've been blessed to be surrounded with some really, really strong mentors.
Okay, and how many courses are you organizing annually on average nowadays?
On average, probably about 20 to 25.
And what percentage in Canada versus United States and then outside of North America?
I would say it's probably 90% Canadian based.
Mm.
And of that, probably 75% of it is based in Ontario and mostly the Toronto area.
I see. And you, because of your sports background, I've found that most sports docs have a history of playing sports. That then the passion of their youth then gets extended into their adulthood, into their professional lives. And so, would that be your background?
Yeah, so being from Canada, I was a hockey player. So I had a natural draw to hockey. Growing through high school, I played competitive doubles tennis and competitive soccer. And then I got into, when I was in chiropractic student and graduated, got into running. So I got really involved in the running world and then into the weight training world. And then through all my sport exposures, got exposed to Taekwondo and some of the mixed martial arts. And we had the 2015 Pan Am Games here in Toronto. So I was involved both in the Pan Am Games and the Para-Pan Am Games, mostly at the swimming venue, diving venue, and the fencing venue. As well as in 2010, I was involved with the Para Games in Vancouver at the Polyclinic at the Vancouver site.
Very good. Interesting. So you've been able to take that passion into your clinical practice and perhaps into some of your research.
Yes, that's absolutely, absolutely.
Well, very good. So you've been kind enough to invite me to teach a couple of DNS courses later this year in September and October in Buffalo, New York. And I'm excited to be a part of that. And it's the first time we've worked together for courses. So what led you to consider DNS courses? Because I believe these are the first ones you're integrating into the MSK Plus model. And so what led you to think of me and to help to organize this?
So DNS has been on both my kind of clinical radar as well as my company's radar for about 20 years. I've been really interested, but just never had the opportunity to have an instructor come to the Toronto area. There's numerous instructors from around the world, but I actually haven't had the opportunity to have an instructor come and deliver for MSK Plus in the Toronto area. So through my contacts and through our discussions previously, when we've met at different venues around the world, I said, well, it's time for me to again, selfishly, I want to get the exposure to that clinical opportunity. And you and I decided that Buffalo would be a central area for you and a central area for us folks from Ontario to come down and to actually host the event. So that's going to be set for September 27th and 28th in Buffalo, New York. And then the B will be set up in October 25, 26 in Buffalo, New York.
Right. And we first met, we were just talking about this, and you helped to remind me. We first met, I believe, in Greece at the World Federation of Chiropractic conference and symposium 2015 in Athens, and had a chance to get to know each other a little bit there. I enjoyed many years of working with the WFC, both as the president of actually one of the member countries in Central Europe, Slovakia, and also being involved in teaching DNS courses and golf courses and just general rehabilitation courses over 10 or more years. So I have great memories of my time working there, and so that gave us a chance to get started. So when you were considering a course, then you thought of me. And I have taught multiple courses in Canada in the past. In the earlier days, I taught at CMCC actually a few courses for the A courses, and then also in Quebec, taught A and B courses both while I was up there. So I have great memories of my time up in Canada and teaching those courses. And dear friends, including Kevin Weeks, who was up in that area, who's a Toronto native, and dear friends, former Secretary General of the World Federation, David Chapman Smith, and his wife, Dr. Sierra Borges, are longtime dear friends, who I have invited to come on, and we'll be hopefully interviewing and enjoy a podcast together here in the very near future, by the way. So I'm very excited to be a part of this with you and working with you. We also talked about the fact that this is an A and a B course within about a month for DNS course. And it's interesting how sometimes history repeats itself. But in our earlier days with DNS, we would teach courses often even on bookend weekends for A and B for our students. I would do these courses with Dr. Dave Juring, who's a professor at Palmer Davenport, and we used to organize those courses. And then as time went by, we started to spread out the A and B courses 6 months, a year between the courses, and we recommended. But it's a different day, and now because of the way we structure our A and B courses, the first course is designed to teach you, in addition to basic principles, is also designed to help you to understand how to perform exercises and assessment in one specific type of a movement pattern. Talk about as holokinetic, which means that we don't differentiate movement patterns between our upper extremities or our lower extremities. They move together, which is, and the way it's structured is excellent with our courses. But you need to take that B course in order to then get the full, complete human movement pattern experience and assessment. So as a result, I've started to recommend the A and B courses be done very close together so that our DNS students can then learn how to understand the fundamentals of what we talk about as differentiated patterns. And probably I should say that the A course actually is non-differentiated patterns. So that means the arms might move together and the legs would move together, but differentiated patterns means one extremity on one side and the other side move together in concert. And so we have differentiated patterns are covered in our B course. So then once you complete that B course, the clinician the student has the opportunity to really understand the broad spectrum of human locomotion, from the basic foundational aspects, has basic assessment skills, and has also the beginning of understanding how to integrate corrective exercises in following a DNS model for the whole movement, human movement of differentiated and non-differentiated movement patterns. And so I think that this is why I suggested this to you, and I'm hopeful that those that are listening will help to share this information, because I think A and B courses together now is coming back in vogue, and I really support that.
So, Craig, can you tell me, would this audience be just chiropractors, or would it be physiotherapists as well, or athletic therapists, or kinesiologists?
You're talking about for DNS or for Aces
DNS.
Optimus? DNS? Oh, DNS? Yes, we have. Well, it started since I helped organize the original course and have been in North America that included both Pavel Kolaj and Lena Kovasova. We invited physios and chiros to the initial course, and it started that way, but then it expanded out. So we started with our A, B, C, D courses for the clinicians. But then we saw that there were others that were not necessarily licensed clinicians, such as personal trainers and ATCs, even Pilates instructors, yoga instructors, who were very interested in understanding our principles. And it also was important for the clinicians to have somebody to continue with the exercises, understanding our principles, so that after we release them from the clinic or reduce them, their reliance on us and need for regular care, that they'd have a trainer or somebody to help to take care of them and direct them following DNS model exercises and posture and lifestyle. So as a result, we expanded out to the exercise courses, exercise 1, 2, 3, and so that expanded out. And now we found that we get a lot of varieties, because different countries have different types of specialists and clinicians and healthcare providers. You know, when I would teach in South Africa, they had kinesiotherapists down there, for example. And so as a result, we've adapted to the various regions of the world and the providers that have an interest and practical application for DNS principles. And for us, because DNS is foundational to human locomotion, we end up then integrating with other types of healthcare providers and other approaches to healthcare. So we work together. If they could, whatever type of rehabilitation model you want to integrate and training model you want to integrate, DNS principles form the foundation of how we move, how we gain our control, our postural stability. And as a result, then whatever we then work together in concert with higher levels of training that just integrate our principles. And then we expanded into our courses, so that now we have specialized courses. We have certainly courses for example, surfing and for tennis and for weightlifting, for specialized courses. We have courses for pelvic health, pelvic floor health. We have, then we also have expanded now into courses with pediatrics. We have our pediatrics 1, 2, and 3. In fact, in September 5th to 7th, we'll have a pediatrics 1 course here in Tulsa Broken Arrow area, and I've invited a brilliant young physical therapist, Jerry Halamka from Prague, from Motol Hospital at Charles University, former elite soccer player, and now an elite pediatric physiotherapist, who's going to become the lead teacher, and I'll be assisting. And so we still have seats available for that course. Just as we've been talking about our courses in Buffalo, we still have seats available for both the DNS A and B course. And so for the PEDS course, you can look to ACES for me. That's ACES number 4me.com for the pediatrics course, and you can go to MSK dash or hyphen really hyphen plus plus.ca to learn more about the A and B courses we have in Buffalo and to register. And we'd love to see you there. So then um, I think one of the other areas that I wanted to understand more in your background and I have to say we teach and are involved in teaching for the same reason. And I wrote my low back syndrome textbook, which was published in 2006, and the main reason is because I wanted to learn from. Oh, there it is. Thank you for that.
I did want to ask you a bit about that, but I'll let
Yes.
you do your preamble first.
Well, I'll just say that, I had the opportunity to learn from a number of the greatest spine experts in the various fields from around the world. So it's the same reason I think, rationale that you had to organize your courses. You were in search of more understanding, more knowledge, more skill. And so I wrote a book so I could pull them in and learn from them and edit, and they were good enough to allow me to edit their chapters and learn and ask them one-on-one questions for clarity. So from an academic standpoint, it's a dream come true. From a responsibility standpoint, it's a nightmare, and it took me 5.5 years. So to get that book out. But I think we were on the same, we were both in search of understanding, of knowledge, and of growth. And so I think we are kindred spirits along that line. So you had some questions about the book.
Yeah, so you have arguably some of the top spine people in the whole entire world contributing to your book. How did you make those connections? Did you just reach out to them, or were you introduced to them? Like, for example, Kirkaldy Willis, we actually had a chiropractic teaching clinic with Dr. Kirkaldy Willis in Saskatchewan that Dr. Cassidy had set up years ago. Unfortunately, 2 years before I was set to go there for one of my residency placements, they discontinued that placement for the CMCC residents. So I actually didn't get an opportunity to go. But I did speak to some of my cohorts that were ahead of me, and they had nothing but praise to talk about that clinic with Dr. Cassidy and Dr. Kirkaldy Willis. So, for example, like, how did you get Dr. Kirkaldy Willis to write the foreword?
So it's interesting. First of all, you mentioned Professor David Cassidy, a chiropractor who was really, I think, the first to collaborate with a leading physician in research. And he did that in Canada after Professor Kirkaldy Willis, who was British, and I would say the leading spine surgeon in the second half of the 20th century, actually. And so he relocated to Canada, and they worked together and did some early research, which was groundbreaking for the chiropractic profession in the spine world. And then later on, Professor Kirkaldy Willis then taught at the American Back Society courses. And I was a big fan of their work. And then I gradually became an instructor along with Dr. Don Murphy for American Back Society. I really loved their model because their model, they allowed chiropractors, physical therapists, and physicians, all were equal members, so we could go and learn together and share information, and also obviously PhDs. And so as a result, that's how I got to meet him, because I was an instructor there, and so I was very honored to have a chance to meet with him. And I was looking for somebody to write the foreword. So we started talking about it. And of course, Dr. Cassidy, Professor Cassidy, also was involved in co-authored one of the chapters. So that helped because they were longtime colleagues. And so I asked him if he would consider writing the foreword. And so he says, well, send it to me and let me just take a look. And then when he reviewed my book, uh, he was extremely excited about it. And he says, I really want to write this forward because this reminds me of all of everybody working together, all of the specialties talking about what they're learning. And he says this is like going like a residency and a fellowship where you're learning from all of the top people and it's all practical. And he said, so this reminds me when I was at Oxford that we used to have what we called a combination room. And what that was at dinner time, all the students and their professors would to get together, have dinner, and then chat and talk about life. Because very often, you end up learning more when you sit down and have dinner, have a beer with a colleague and a mentor, because you've enjoyed the time in the class and the structured course. But then life's activities and motivating actions and activities that really impacted you are discussed, over a drink or over dinner. For this was my main learning experience with my main professor, Professor Vladimir Yonda, was drinking scotch with him until all hours in the morning. And that's where I really learned the practical aspects and hit what was his inspiration. And so once he saw my book and he read it, he was very excited. And then as a result, he wrote what I would consider a dream come true forward for my textbook, which really, I think, had a big impact, because I didn't write the book for chiropractors. I wrote the book for the whole spine world, because I felt as though we are too disparate at times and we need to understand other standards. And I also, probably more than anybody, wrote it for chiropractors and for the physical therapy profession, which was in the process in the United States of organizing a doctorate degree. So they were in the process of becoming primary care clinicians, primary access clinician also. And so I felt as though we needed to have a better understanding of what other logical, reasonable, and evidence-supported approaches to healthcare for the spine were available, so that we could understand how to optimally co-manage these cases with other experts. So that was kind of the basis for the book, and Professor Kirkcaldy-Willis um, got it. And I'll tell you one quick story from the American Back Society from him. We were all asked, a number of us that were instructors were asked to go up on stage, and the founder of the American Back Society was Dr. Schwartz, and he gave us a very complicated case study and then asked each of us within our specialty how we would manage it. And Professor Kirkcaldy-Willis was sitting next to me to my left. And when he was asked, he said, well, if I got this case, what I would do is I would cancel my patients for the rest of the day. Then I would go home, and then I would mix myself a drink. And then I would really have a long, slow drink thinking about that. And after I was finished, then I would get myself a second drink. And by this time, everybody in the audience was laughing. And my main concern at that time, as he then gave some of his insights, was I was praying that I didn't have to follow him. And fortunately, I wasn't asked next, because that would have been an impossible person to follow, because he was so charming and he was so brilliant and he was so funny. And this was the great Kirkcaldy-Willis that people who were lucky enough to meet him and to know him. He was a great leader and an integrator and an organizer in the second half of the 20th century. So yeah,
That's an amazing story. And
yeah,
I also see Diane Lee. She
yes,
contributed to one of the forwards as well.
yes.
Can you share with me how you come? Because she was a presenter at one of our pregnancy courses that we run through MSK about a year ago. So I had quite an opportunity to chat with her online about her book, The Pelvic Girdle, and her work with Fleming and Professor Menz and those kind of people. How did you come to meet Diane Lee?
So Diane Lee was also an instructor at American Back Society. So every year we would get together in different cities, but mostly in Las Vegas. And what would happen in the end is there were two leading physical therapists, instructor is Diane Lee, and another doctor whose name I've forgotten. He teaches out of New York, the Australian physical therapy courses. And then also Don Murphy out of Rhode Island, Dr. Don Murphy out of Rhode Island and Brown University, my brilliant colleague and friend who we studied together in Prague. And then we co-authored several chapters, both in my book and also a chapter in Scott Haldeman's textbook. And so the four of us would get together, we would sneak away, and we would have wonderful dinners talking about the areas in our respective professions where we were very excited and other areas where we were less than excited, and where we could just kind of, and we would have wonderful discussions that would go long after dinner, and with very patient waiters and waitresses allowing us to just continue to talk, and we would have wonderful meetings. And so that's how I got to know her very well. Like I said, those dinners, those social times, the times where you really get to meet the person. And her background as a gymnast, and her background where she's quite open about even her gymnastics related incontinence issues that led her to become a physiotherapist, and then a leading instructor, and her work together with the Brisbane School of Physiotherapy, with all of the wonderful physios there that were also all students. The leaders were students of Professor Yanda. That's how we got to know each other, and that's when I asked her. So she said it very clearly. She thought, well, this is a chiropractic book, and then once she understood, well, it wasn't, and that we were fortunate to have leading physios from around the world, in addition to leading chiros and neurologists and radiologists and spine surgeons. And so as a result, I think because of that, the book just continued to actually sell. So we still get sales of the book, and now it's almost a 20-year-old book, but most of it is actually still very relevant and very up to date. You would think that's not true. There are newer citations, but from the practical assessment and from the practical management and the therapeutic side, surprisingly little has changed, actually. Most changes, I think, have occurred in the pain management world from my book. So that's, anyway, those are two of the Canadians who were contributors to the book.
It's an amazing book. So just again, if you haven't had a chance to have a peek at this book, probably one of the most comprehensive collections of chapters on low back pain management and assessment that's available.
Yes, well, thank you so much for that plug. And yeah, for me, it was, it was something I needed to do and I need to get out of me. And it was well received around the world. And fortunately, what I wanted to not only be a chiropractic book, but I think that, as I've said, for chiropractors, speaking to the chiropractors and for the chiropractors, for us to be true spine experts, it means we must understand what the other specialties, what the other experts are doing, and why they're doing that, and when it's appropriate to refer to them, and when it's appropriate to co-manage with them, and how to be able to have discussions that are educated discussions where you understand their terminology and their procedures, and more than anything, for young doctors who are looking to grow their practice, is you need to understand what are these other specialists, what are their problems? Because if you want to grow your practice and have a multi-specialty referral base, then what you need to understand is how can you help them? As a student, I thought, well, I need to figure out how I can get them to refer patients to me. And that was the wrong mindset. The correct mindset is, what are their problems? What are the cases that come in where they think, oh, that patient again. I've tried everything I know to do. I don't know what else to do, and I don't even know what to say to them. And I've got to kind of, bluff it, or I've got to try to say, restate something. But instead, if you have say, I do know this clinician this chiropractor, this physical therapist, and they're not typical. They're outside the norm. They understand my work, and this is somebody who I can send them to, and maybe they can help them. And it also, I'm not sure what to do with them, so I'm going to send them there. And I think that then you become a real resource in your community. And so that is, to me, a very important concept, and one of the areas where my book, I think, has been quite helpful. I've also had doctors send me very nice notes saying that to get to know the local spine surgeon in the area, they sent them a copy of my book with regards, and that broke the ice. And so it's been used in different ways, and I've heard it's been very nice to hear from people around the world regarding the book and its impact, because that was the idea.
Congratulations on that book. From a 5.5 year preparation, I don't think we'll see a second edition coming out from your library anytime soon then.
At this point, no.
Okay. We'll have to pass the torch to the next generation.
I think so, but you never know. We'll see what happens.
So just with regards to the Buffalo courses, what kind of Monday morning kind of takeaways might we get when we leave that course after the A part?
Well, when I organize my courses, the goal is for us to have a specific clinical plan for each student. As for Monday, it's got to be practical. If it's just theoretical, if it's a lot of information but you don't know how to apply it, how to utilize it, then I think it's unsatisfactory. It has to be practical. So as a result, during the course, usually our students will find cases. If they have clinical practice, it will, with the issues we discussed, they'll say, oh, this reminds me of this patient. Oh, this reminds me of that case. And that's what I want. I want those aha moments with those students so that they have something like that. And then we discuss that, and I encourage them to share with me so we can give an idea. And we want the students to hear it because that gives them idea of practical application while they're still students. And I think the DNS is the time to learn it and understand it is while you're a student, because this gives you the foundations of how we get stabilization and how we become functional bipeds.
Amazing. I'm looking forward to that course in September and October.
Me too. And I think as we start to close up, then I must thank you so much for taking the time, Glen. And I have really enjoyed getting to know you better. I'm looking forward to spending time with you in Buffalo at our courses. And I have to once again thank you for the opportunity to come and teach for MSK Plus. And remember to look for MSK-plus.ca for Glen's courses, because he has a lot of them, and a broad variety of courses, both Canada and in the United States. And also, I hope you'll visit acesforme.com. That's aces, number 4, me.com, to see our upcoming DNS courses this year. And we're getting ready to also organize our 2026 courses. So, and you'll also be able to find we also are adding referral sites for clinicians, for educators that I consider to be very important, worthwhile, and recommended. So just as I will be adding, for example, Dr. Greg Doerr's courses, then we'll also be adding MSK Plus courses. So there will be well, what is it called to refer the pace to your site? There's a term.
The hyperlink?
Yeah, like a link. Sorry, this is newer
Okay.
stuff to us guys with lots of gray hair like me. But a link so that you can that'll take you to MSK Plus and to those that I consider to be really excellent, top drawer course organizers and instructors. So with that, I would like to once again, in closing, thank you for taking the time to be a part of Aces Optimus.
It's been my pleasure, Craig. Thank you so much for the invitation to chat with you today. I look forward to more chats after the course at dinner and such, and we'll see you in September.
All the best. Take care. Bye-bye.
Thank you so much. Bye-bye.
Thanks for tuning in to this episode of the Aces Optimus Show. Catch you on the next one.